Welcome to the Geula Mamas show, your place for everything pregnancy, birth, and babies. I'm Tivi Goodman, midwife, doula, mommy, and the host of the Geula Mamas show. I'm here today with Leah Prejserowicz. Hi, Leah.
Hi.
And she is a psychotherapist specializing in helping parents deal with all the mixed emotions children bring up, dealing with anxiety and connecting and improving relationships between parents and children. Leah runs a postpartum group for mothers and babies in Renana to discuss these issues, figure out how to deal with them, and bring back calm to the home. What an amazing topic. I think we could probably make this into an entire series alone. Thank you, Leah, for being with us.
Oh, thanks for having me.
Wow. So before we even launch into this deep dive, I would love to know, how did you get started in this field?
How did I get started?
Always wanted to do?
Not really. My mom is a psychologist. It was always kind of in the family. But I didn't really know. It kind of just, happened. And I studied and I found things that were interesting. And it's only quite a recent thing that I've started specializing in the anxiety aspect of therapy. It's something that I experienced myself growing up in South Africa and experiencing anxiety on my own. I mean, everybody that lives there experiences anxiety. Anxiety actually becomes normal being there. And a lot of the time it influences our lives in so many different ways, and it influences people's functioning. And it's become a very big, part of my life, but also of helping people get through it, because I've been able to get through it on my own. So in a nutshell, that's it.
That's amazing. So you live in Renana. How many children do you have?
I have 4 children.
Oh, that's beautiful. Wow. What are their ages?
So my eldest is 8, and then I have a 6-year-old, all girls, a 2-year-old, and a 6-month-old. So she only just recently started mishpachton. So I also incorporate a lot of my personal experience into my work, because how I was with my first and how I am now with my 4th, it's a completely different ball game. And the anxiety that I can feel as a mother, and the fact that she doesn't want to take a bottle and eat, the anxiety comes in so many ways and affects so many different things in our lives. So it is amazing to see how much I've grown as a person and how I can incorporate this in my work and help people get through it as well.
And as a mom of 4 girls, I imagine you're somewhat of an expert on emotions by now.
You can call me an expert of emotions. I mean, it's very much a part of our everyday conversations, and it comes into that. And then also my work, I incorporate it in my work a lot. So yeah, it does become an everyday language, to talk about it and become aware of what we're feeling. And it's a language that you do get used to when you incorporate it in your everyday language and conversations. So yeah.
Wow. So I don't even know where to begin. I can just think of pregnancy, childbirth, postpartum, first baby, integrating after, further baby. There's so much to talk about. There's so much to talk about between you and your baby, between yourself, your spouse. It's endless. So why don't you just get started, and I'm going to be listening and learning and enjoying this.
Okay, so basically, anxiety can come in so many different forms and at so many different times. If we want to talk about postpartum anxiety, which is, the kind of people you want to educate, postpartum anxiety can start anywhere from the moment that the woman determines that she's pregnant, the moment she realizes it, and it can happen straight after the birth. It can happen a few months after the birth, up to the child's first birthday. So there's a huge spectrum of when postpartum anxiety can start and what it means. And basically, I'll give you a little explanation of what anxiety is. Basically, we have some kind of trigger which causes us to have a thought in our head. And this thought can be a catastrophic thought of something bad can happen, or something, I'm a terrible mother. It can be any thought, and every person's understanding and interpretation of different things will have a different thought basis. But the fact that it's anxiety is that this thought causes us to feel anxiety. Okay, so I'm going to start and just give you an example. If we see a snake, okay, you see a snake on a table, our automatic response is to feel fear. Okay, we're going to, a part in our brain called the amygdala is going to be activated, and we're going to be able to react based on our survival instincts that we have. Fear sets off something in the brain telling us that we either have to fight, kill the snake, we have to flee, we have to run away from it, or we have to freeze and play dead so that the snake doesn't attack us. So sometimes, I mean, most of the times we don't have control of over how we're going to react in a dangerous situation. And those are the three ways that we can react. So having fear is a great thing. But what happens when we have anxiety is that we have this continual fear and we're not able to get rid of it. So a lot of the time, well, firstly, it'll cause us, you know, all these like our heartbeat will increase, we'll start sweating, we have all these physiological symptoms that'll cause us uncomfort. It'll also make us physically and emotionally exhausted because we on this like adrenaline all the time. It's great if we're in a feel-filled situation, we need to react. So the problem is when we have this and, you know, we keep what's the word? We keep reacting the same way even when we're not in a dangerous situation. So for example, if you're thinking all the time, I'm a terrible mother, you know, if I don't respond to every cry, what does that mean about me? Then we may feel those kind of physiological things at the same time. So we're always going to be anxious. We're always going to be worried about what's going to happen. We're always going to be, you know, overthinking things and not able to react from a calm place. I mean, I want to like give you different examples, but I don't really know which way to go from here.
No, examples are great because they really bring it to life. So
Okay.
Yeah.
Okay. So if I want to talk about my own personal experience, basically how I was with my firstborn was a lot of the time I felt like I needed to respond to every cry. You know, if I have to stop for a second and do something else, you know, I started thinking all these things. Oh, I must be a terrible mother if I'm letting my child cry even for a couple of seconds. And, you know, I started getting all these thoughts into my head that if I'm not perfect and if I'm not doing exactly what I'm supposed to do, then, you know, I'm going to ruin what goes on, and I'm going to have all these consequences basically of what's going on. So a certain amount of these thoughts are actually normal. You know, we do need a certain kind of worrying. A lot of mothers think, oh, okay, you know, my baby might drown if I put the baby in the bath. So on the one hand, yeah, we do have to have a certain kind of over-awareness that we're not used to having, you know, before we have a child. And we have to say, yes, we're not allowed to leave a newborn baby in a bath without being supervised. So a certain amount of worry is actually necessary for parenting. But what happens when it becomes a kind of worry that we're not able to get rid of? We're not able to sleep even though we're completely exhausted. Our eating changes. We're not able to eat. We're supposed to be nursing a baby, but our eating is affected. It affects our milk. You know, there's all these kind of things, you know, like how much of it is normal and how much of it is above and beyond, and what can I do about it?
Right. So, I've known rarely, but I have known some moms that were what you're saying, the opposite, where they were just, it stuck out because, like, for example, my daughter was all of maybe 5 or 6 years old, and I knew someone who had a premature baby. And this mom had a number of children, and this little, very delicate preemie, he was maybe 6 weeks old or 2 months old by then, which is very young for any baby. And she basically, I wasn't there. My older daughter had taken my 5-year-old to the park. And this mom just let my 5-year-old change diapers, watch this child, take him on the slide, just like not safe in my opinion at all. And she was a very relaxed, very laid back type of person. But in my opinion, that was not safe.
Right.
So that little bit of anxiety should be there. Maybe that awareness should be there, but not to the level where I have, like what you're saying, where I would get anxious. I was worried that I wasn't attending to every need and that everything needed to be. So that's already too much.
Mm-hmm. So right, I think a lot of it is being able to find the balance and find, on the one hand, I have to be anxious enough to be cautious and to be aware of my baby's needs and to be able to take care of my baby without putting him in any kind of danger. But on the other hand, we have to be able to be in tune with our own needs and say, okay, I need a break. I need somebody else to change a diaper. Okay, it shouldn't be a 5-year-old, but maybe that was her place where she was just so desperate for a couple of minutes, on her own. I don't know what her situation was.
It happens to be her nature. I think it was compounded by the fact that she was pretty desperate, but in general, that's just her nature. I mean, her kids just kind of, that's just who she is. I've learned then.
Okay. No, so the question is, was she able to watch and make sure that everything was okay, that there wasn't any kind of, no, she just left okay.
Yeah.
So she wouldn't come to me for anxiety.
No, I don't think so.
No. But then on the opposite spectrum, there's people that are so anxious that can't turn the thoughts off of what if this happens and what if my baby stops breathing when he's sleeping. I have to go every 5 minutes and check that he's breathing because otherwise I won't be able to sleep. And then because I land up, checking every 5 minutes that the baby's breathing, I don't land up sleeping myself. So when does it become, it is a quite broad, it's a continuum, and you have to figure out how much of it is affecting your life, how much of it is affecting the way you sleep, and the way you eat and the way you function on an everyday life. Even another example, if we talk about babies that cry in the car, they don't want to be in the car seat or they don't want to be in the stroller. So, you'll have some mothers that say, okay, I can't let my baby cry, so I'm not going to go anywhere. But then she's feeling resentful because she's not able to go anywhere. And then on the other spectrum, okay, you'll also have those mothers that will put the baby in the car and drive to a light and the baby will scream for 6 hours. I mean, maybe they'll have anxieties about different things, but it won't be on the parent-child bond.
But it is good to hear from you that the thing that gives us that anxiety intrinsically is good. That is what's making us a good mother. It's just the levels, just the balance. But just like when you were saying the example about the snake, if I see a snake and I'm like, poisonous snake, lovely, and I go on, that's just not healthy, right? So to say, okay, this thing is coming from a healthy place, I don't have to get rid of it. I just need to work with it and balance. One of my children has epilepsy, and the doctors say she'll grow out of it. We'll see if they're right about that. It's called childhood epilepsy, and she can have seizures when she's sleeping. And hopefully it's under control. It just happens every so often if she's on a ketogenic diet. So sometimes when she has a growth spurt or something gets out of balance, and it happens as she's falling asleep or in that stage of waking up, or just sometimes randomly. And occasionally it's happened when she was awake. So I fight that urge not to have her sleep with me constantly. There's nothing I can do. It's not technically dangerous, but knowing that your child having a seizure is really scary. But having her sleep in my bed all the time ruins my sleep. So I've just been going through this whole thing and sort of working on that balance of making sure that she's okay, making sure that she's safe. If she should have a seizure, I moved her bed from the top bunk bed to the bottom bunk bed, and different sorts of things like that. But then saying to myself, it's okay, I need to sleep. If I went through times where she had a few seizures, so I would have her sleep with me for a while, and then saying, okay, that's enough. A week, 2 weeks, I'm falling apart here. I'm not going to be a good mother if I don't sleep. So I've really been grappling with this, even though she's 8.5 years old already, not a newborn. But absolutely, I connect with what you're saying.
Right. No, but your ability to say, okay, it is something I need to kind of keep an eye out, but I also have to be in tune to what I need, and I need sleep. And you're right. Without sleep, you're not going to be able to function. And it's really important that you come to terms with that and say, okay, ideally, yes, she would have somebody watching her all the time to make sure that, not to make sure that it doesn't happen. We don't have any control, but to make sure that, I wouldn't regret not being there when it happened or whatever.
I just want to hug her or hold her or be there for her to have to come in the middle of the night and say to me, it makes her mouth sluggish, like, oh, and I feel my heart breaks for this little girl, but having to walk myself through those steps it's really challenging,
Mm-hmm.
So yeah.
Right, absolutely. And it's an ongoing changing thing. It's not, I have to be attentive and close to her all the time, or I have to sleep all the time. You may also have to play between the two to make yourself comfortable and to feel like you're doing as much as you can for her. It is an ongoing process of the figuring out what's right for right now, and not thinking, this is what I have to do all the time. That's also a healthy place to be, is the ability to keep moving and not necessarily be stuck on one specific way of acting. So
yeah, what I have done is, if she's gone through a growth spurt, or there's been a change, or she's had a couple seizures, so I'll put her in my bed for like 3 or 4 days, and once she has had maybe 5 days of no seizures, then she goes back to her room. And I just also have to just say, my friend said it. She said, "See, Tivi, this shows you you're not in control of seizures. Hashem is in control of seizures."
absolutely.
And I also was the type of like, is the baby breathing? It's the same type of thing. I'm a very, I don't know, maybe I'm a control freak. I don't know, but it's scary when you've heard stories or you've had experiences. You want to be able to be there for the people who you love all the time, and it's not that way. It's just not the way.
Right. Absolutely. It's exactly that. It's passing responsibility over. Hashem decides, what happens and when it happens, and whether we're watching them, not watching them, if they're at school somewhere else. It's something that's not easy to go through. Definitely not easy to go through for most mothers, but it is a kind of letting go and realizing that it's not in my hands always. Difficult to come to terms with at times, but it is something we have to realize we have no control over.
I think it's part of our growing up process, which doesn't stop with age, right?
No. There's always something new to learn and implement in your life, that's for sure. And to realize how our thoughts are affecting things that we do, because that's also a huge aspect. Yeah. So yeah, you see that the postpartum, it doesn't stop at a year. It's something that is ongoing with the parenting and bringing up children. And we'll always have one child who needs more of this, parental anxiety or cautiousness, or, that they need more, or at a specific time they may be going through something and need more attention. And it's an ongoing figuring out of these kind of things and finding the balance that works for us and for our children. And it's ongoing, it's changing constantly, and it's we have a partner, a husband in the picture, and how's he influenced, it all goes together. How he sees it, often, the parents seeing the ways in such drastic different ways that they have to, stop and take a look and see what's the right way, how do we integrate both sides. Yeah.
I have a question about something that you said.
Yes.
In terms of postpartum anxiety, starting at the beginning of pregnancy and going to 1 year, the possibility of that happening. So is that sort of the medical definition? Because if I'm, 3 months pregnant and I'm anxious, I would never think of that as postpartum anxiety or postpartum depression.
So firstly, a lot of people that okay, I'll start with this, that postpartum anxiety, for some reason, is not as well known about than postpartum depression. A lot of people have kind of heard of what postpartum depression is. Postpartum anxiety is actually much more common than postpartum depression. It actually hits about 10 to 11% of the general population, which is quite a lot. A lot of people that do experience it have had some kind of episode of feeling anxious or having a panic attack in the past, or having, it could be an eating disorder, or having something in the past that could set it off. Body image, a lot of things can set off the anxiety. But in general, from the minute you're pregnant, you have all these different hormones. The brain is, you're building a new body and you have all these different hormones, and these things can also set it up. So this is the reason that it's called postpartum anxiety, and not just anxiety. If you're anxious and you become pregnant, you'll continue to be anxious. But together with all the hormonal changes and the sleeping changes and the, everything that goes along with the pregnancy, When it starts only from the pregnancy, then it's called postpartum anxiety.
So what can we do to educate ourselves to know if we're having that, to maybe prevent it or treat it? How does that work?
So, I mean, a lot of psychiatrists recommend medication to treat the anxiety. From my experience, treating the anxiety through medication isn't the best way to treat it, because it may help with the symptoms now, but it doesn't help long term. And it is something that needs to be dealt with long term. CBT, which is cognitive behavioral therapy, it's proven to be a really, really, what's the word? I'm thinking in Hebrew. Productive way of treating it. That's not the word.
Effective?
Sorry?
Effective?
It's a very effective way, thank you, of treating it. Cognitive behavioral therapy is basically dealing with the thoughts that cause them. They're usually negative thoughts, and those are the things that we hold on to. We have negative feelings, get into it's basically a triangle. So it's got the unhelpful behavior, the negative thoughts, and the thoughts that we come up with. And something is not working in that triangle, and then you need to be able to treat those different aspects of it, and that's what cognitive behavioral therapy is. And they teach relaxation techniques and teach how to break down the thoughts, figure out where they're coming from, and be able to change those thoughts, and also change the feelings that we often feel of helplessness and hopelessness and anger and irritability that comes up with feeling anxious. And it all kind of goes together, because as soon as you're not sleeping and you're not eating and you're round the clock taking care of a little one, and you have all these society's expectations of what a good mother is, and what you're supposed to do, and you're supposed to breastfeed, and you're supposed to go back to work at a certain time, and you're supposed to be the most attentive mother you can be, and all these high expectations of what other people and society expect of us, that also has an effect of how we see ourselves and how we're able to get through this very sensitive time.
So it sounds like I'm kind of hearing three pieces here. One is self-care, eating, sleeping, taking care of myself. One is expectations, looking at my life realistically and saying, is this real for me? Should I expect myself to, be super mom, be supermodel, getting back to work, whatever it may be? Is this real for me in my life? How can I be true to myself? And the third thing was, what was that now? I'm kind of forgetting. With the anxiety, just putting that into sort of breaking down the piece. What am I anxious about? Where's my place in this? Because sometimes we can feel anxious without knowing why we're feeling anxious, right? There's these overwhelming feelings, and once we figure it out, oh, I'm actually anxious about this piece because of this, maybe something in my history or something I read. We can sort of like liftor. I'm also thinking, liftor the baya. We can sort of open this puzzle, and then it demystifies this magical feeling.
So in an ideal world, you're right. If we're able to self-care and we're able to deal with those pieces on our own, then we wouldn't seek help necessarily. But if we're able to, we logically know I need to sleep and I need to eat, but I go and lie in my bed and toss and turn because I keep worrying about what's going to happen, and what's, if I sleep, this is going to happen. And if I all these worries that don't allow me to sleep, then that's when I know I need help. Because when you're completely exhausted after having a baby, and you already have to be up, every 2 hours and feed the baby, and you can't stop worrying for those couple of hours that you can sleep, that begins to become a problem.
So one of the things we always tell mommies is when your baby sleeps, you should sleep. And that way they get more rest. Let people take care of you, allow people to take care of you. But not everybody knows that. So if somebody's in a situation where they just don't know, so they can learn, okay, I should sleep more, I should allow people to bring me soup, I should relax. And if that works, then that can fix the problem. But you're saying that if that's not enough, if they know these things, but the anxiety is still there, even though they're trying to do all of these, self-care and things. That's the point where they need to seek help, you're saying.
Mm-hmm. Right. Absolutely. Because, a lot of people will say, okay, yeah, technically you should get help, and if people bring you meals, you should be grateful. But then you'll have some people who feel like failures when people bring them help, or they'll have these negative thoughts about, what it means that if people are bringing me help, and they won't be able to accept it as a gesture of, I'm trying to help you. They'll have all these, they have mistakes in the way that they think, basically. And it could be also due to all the hormones and going on. And I don't want people to help me, because then they'll see how, my house is a mess, and I don't want them to have to come and bring me food. There could be so many things laying behind that. So on the one hand, yeah, you say, get as much help as you can, and sleep as much as you can. But it's sometimes too simple to say that. Sometimes, people aren't able to do those things, regardless of whether they know them, logically they know them, but there's something that's preventing them from doing them.
Absolutely. Absolutely. I feel like when you're saying that postpartum anxiety can begin in early pregnancy, what it triggered for me was, if you're expecting a baby, and what I did is I never thought about what would happen after the baby until I was after the baby. And then I learned with subsequent pregnancies, no, plan that way in advance. Think about, what kind of help am I going to want? Do I want cleaning help? Do I want to freeze certain foods? Do I want to stock up my pantry? I'm more of a go with the flow type of person. I never really, I learned how to enjoy list making. I learned how to enjoy planning as an avoda, as something to work on through the years. But by nature, I like to just get up and, go to sleep when I want to, get it right. So then it would lead me, though, after the birth, to sort of be subjected to other people's whims. And then you find yourself sometimes in a space that you don't want to be. And that seems like that alone can be triggering the anxiety for someone who's more triggered. Obviously, some people are just less anxious people by nature, right?
Different people are triggered by different things. Some people might be so triggered by what's going to happen in the birth. What if things go wrong in the birth? What if the baby's not okay? And they're not able to see past what's going to happen the first few weeks when I need food, because they're so blocked on what's going to happen in the birth. That's where all their focus and energy goes, and they're not able to plan ahead. Different people it'll come out in different ways, the anxiety, and it's very individual in how it does come out.
One of the things you mentioned was that if somebody has a history of maybe anorexia or anxiety or panic attacks before pregnancy, they're more at risk. Obviously, they should maybe, take more precautions, learn about these things more. I see that even with my children. I have certain children who will say, Mommy, I'm very nervous about first grade, or what's going to be. One of my kids said, what if you and Abba go out and both of you die at the same time, and they started listing all the big siblings, and everybody dies at the same time? Who's going to take care of me? And what's going to happen to me? And where do I go? And none of my other kids asked that. So and this is definitely a child who has more of an anxious nature. So that's
at the same time, some children may have an anxious nature, but they won't ask those questions. In a way, you have to have a safe environment to be able to ask those questions. And if you're able to give it back to them and say, yeah, you're right, that's a really scary thought, to think that, and repeat it back to them, and you give a place to express those feelings, they'll go away, or they'll grow up and they won't feel that. But when you, as a mother, which is often what happens, get anxious about how they're asking, and yeah, what if that's true? What if we do die at the same time? And yeah, I'm gonna have to leave you by yourself, and you get into this anxious cycle that will only increase your own anxiety and your child's anxiety. So when you're able to say, okay, that is a scary thought, and say it in a calm way and repeat it back to them and get them to understand that it is a scary thought. And we don't, again, we're giving control over to Hashem. We don't really know what's going to happen. We're not able to say that's never going to happen. We're saying it's,
It was good that for me, it did not trigger anxiety for me, which was good.
Right.
I guess I didn't think about that. What I did is I said to her, that does sound really scary, kind of like you said. And then we decided, well, which neighbor do we go to? I actually said to my husband, we should really make sure our will is in place because this child reminded me, I mean, we don't know what's going to be. And, and it actually was a helpful reminder just to make sure. And she felt much more comforted knowing which neighbor she would go to, who would take care of her, how she could get help. So I guess it's good that it didn't trigger anxiety, but it did remind me to get things
right. You took it to a practical, right?
Yeah.
Right.
But I definitely have had all the things that you said, though, about worrying if my baby's breathing, worrying about, even though I'm a midwife, it doesn't mean that when I was pregnant, I didn't worry about the birth. I was having a home birth. So one of the things I did is I printed off the internet a whole bunch of stories of free birth where people have babies with no midwife attending, which in my opinion is not something that's recommended. But I would read these on a daily basis because by reading these stories, my own home birth seemed positively normal and boring. And I was able to calm my own anxiety that way.
Mm-hmm. Right. And I think I don't know how you work with your clients that are pregnant, but I think one of the biggest thing you can teach them is that we don't know what's going to happen, and you kind of have to, take it by stride and not have this expectation of how it's going to go, because I think a lot of women do have this expectation of how the birth is supposed to be, and then they get so disappointed that it doesn't go according to the plan that, that's where all the issues may start. Because this is how I wanted it and this is what it is, so it must be terrible if it didn't go according to the way that I wanted. And we can say what we want, that's important to have a kind of, but we also have to be very aware that we don't have control. We don't always know how it's going to go, and we may need a certain kind of intervention. We may need whatever it is. I think that is a kind of leaving it up to Hashem again and saying, we don't really know what's going to happen, and we can do our best to relax ourselves and let it happen as much as we could, but also not knowing, being in that space that we don't know what's going to happen today, we don't know what's going to happen tomorrow, and in a way that's kind of freeing, knowing that we don't have control over everything. It's quite a lot of to take onto our shoulders and say, I've decided it's going to go a certain way. And when you decide it goes a certain way and it doesn't go a certain way, you often set yourself up for feeling failure and feeling frustration afterwards when it doesn't go exactly according to plan. And not saying that it never does go according to plan, but a lot of people that have had quite traumatic birth experiences set themselves up to how it was supposed to go, and then afterwards they weren't able to come to terms with the fact that it didn't go according to their plan, and figuring out where they are in the picture and what it means to them and about themselves. So
right, I imagine like if you've decided to have a certain type of birth because you feel that it's best for yourself or it's best for your baby, and it didn't go that way, maybe that can already set yourselves up for feeling like a quote unquote bad mother. So then if you're not able to, say, breastfeed or attend to your baby's every cry, it might only reinforce that feeling of, oh, I'm a quote unquote bad mother, which
right.
can cascade into.
Right. I started off of a bad mother, so I am a bad mother, therefore I can't breastfeed, therefore I can't do that. It is. A lot of our thoughts affect these things afterwards, and what I've determined in my head, and whether it's based on reality or it's a lot of the time where it's just based on these kind of imaginary thoughts that we've told ourselves, and they aren't necessarily true, and there's no basis for them, and we kind of just get into the loop thinking these negative thoughts, which cause us to keep going in this anxious circle of how things don't work.
So when you have your workshops in Renana, now you also work virtually, like we're not in the same place right now. Do you also meet clients virtually or only locally in Renana?
I can do private sessions either on Skype or on Zoom. I can do that. And yeah, my group actually is in Hebrew. I tried to interest the Anglo community. I didn't get any interest, but I am interested in opening an English-speaking postpartum group if that's something people are interested in.
How long ago did you make Aliyah?
12 years ago.
That's amazing. that you're running a group in Hebrew after 12 years. I mean, people might say, oh, 12 years is a long time, but it's not a long time. I made Aliyah 15 years ago. I don't know. I mean, I can speak Hebrew, but I don't know if I've never tried to run a group like that in Hebrew. So kol hakavod, that's amazing.
Thank you.
Wow. Wow. So if someone is searching, what do you do in that group? Do you do anxiety or?
So it's anxiety focused, but it's basically everybody getting into their own emotions, into their own thoughts, and how they, I do the anxiety circle with them. So basically what triggers us and what these thoughts cause us and what kind of feelings, are as a result of the thoughts and where I feel it in my body. And we do a lot of experiential learning about what's going on. And we're able to talk about them. We're able to try and challenge them and try and break the cycle of anxiety. And it's also a place to share because everybody's going through some kind of, something that's preventing them from doing what they want. A lot of the issues that come up are, how do I get my child to sleep on their own? Going the transition from holding my baby in the arms, to letting, whatever it is, and figuring out what works for me and what works for my baby, and not necessarily going according to what everybody tells me. It's also teaching people to become in tune with what's right for them and what's right for their baby, and not necessarily what worked for somebody else. So that's, on the one hand, it's very important to hear other mothers going through the same kind of dilemmas. On the other hand, it's very important to know developmentally what's appropriate for a specific age, and also what my instincts tell me as a mother, and being in tune with them as well. So it goes together.
Can you tell us a little more about the anxiety circle that you just said? It sounds a lot like the fear, tension, pain cycle we talk about in birth. And I think I understood what you said, but especially for our listeners, if you could expand on that, it sounds like a really interesting topic.
Okay, so basically you'll have the trigger, which is something that sets off what my thoughts are. And the thoughts, basically, a lot of people aren't necessarily aware of what the thoughts are and what's me and what's my thoughts. So the one thing is teaching people to differentiate between the thoughts. But the thoughts, basically, you'll have these catastrophic thoughts of, I'm a terrible mother. I mean, I've discussed it a little bit before. These core beliefs of nobody's going to want to be with me if my baby cries, or those are the core beliefs. And those things basically, if we do next to that, the trigger of the amygdala, the part of the brain that makes us, react to danger. So it releases hormones, and then it also tells us either fight, fright, or freeze. So either we can get very irritable and we can fight, and you'll have a mother who will shout at her baby and say, "Just stop crying already!" You'll have that, or you'll have someone who freezes and doesn't know how to deal with it, or you'll have somebody who runs away and says, I can't deal with it, I have to leave. Or, they'll do it very instinctually, not necessarily from a place where they've thought it through. And then it's connected also to the emotions of helplessness, of anger, of sadness, of whatever feelings are coming up that are as a result of those thoughts. And then the bodily sensations. And then what happens when we're not in the same situation? We're supposed to be in a calm situation. For example, now the baby's not crying. I should be calm. But what happens in an anxious cycle is that I'm feeling like it's going to happen any second. And so I'm not able to get out of the cycle because I keep feeling that I'm going to be in it again. I'm going to be in the trigger again. And I'm not going to be able to separate myself from anything else. Sorry, I should do a visual and show you exactly how it works. But basically, it's the ability to become in tune with all the different aspects that cause the anxiety and figure out where the anxiety is, even when we're not in a dangerous or fearful situation.
Oh, wow.
Clear?
So what I'm hearing is that the baby crying in the situation, this particular mother thinks that if the baby cries, that means that she's a bad mother, let's say, right? So the baby's crying, and that's what you were saying earlier with the snake on the table, right? That crying baby is the snake. So that then is causing a panic of danger, not just, oh, the baby's crying, or I've been in houses where babies were crying and nobody even seemed to notice. They just went on with their life, right? Because someone else might think, oh, babies cry, that's normal, that's healthy, that's good for them, whatever. Everyone has their own perception. The baby crying does not actually equal me panicking. The baby crying is simply a baby crying. So you're defining that.
Okay, so for one person, the baby crying could be a trigger, but for the other person, a baby sleeping could be a trigger. And then, the anxiety for the baby sleeping could be, wow, I need to be able to check the baby every 5 minutes to make sure that the baby is breathing. That could also be a different kind of, everybody will have their own trigger and different thoughts about what that trigger does. And it's breaking it down and trying to understand it a bit further. But if you, for example, I'm going to use your example of a baby sleeping, that's, it could be potentially dangerous because God forbid the baby will have an epileptic attack or stop breathing or whatever it is. And so you, in an anxious circle, you might say, I'm not going to let her go to sleep because I don't want that to happen. Or, you're setting yourself up to, wow, I'm so anxious to put her to sleep, or I'm so anxious that something's going to happen, that you're already causing some kind of avoidance, or you're already, something is affecting your cycle, if you know what I mean.
Yes. When in a normal situation, when you're not looking at that, the person is simply panicked. So you're taking that panic and they're exhausted and they're stressed out and they're worried. You're taking that and you're breaking that down into the pieces. This is really beautiful. I mean, this is amazing because it's a skill that we use everywhere in our life.
Absolutely.
It's a very useful skill.
And a panic attack is basically, we're not aware of what's happening to us. We're not aware of what's going. We just feel overwhelmed by different images or different feelings or different thoughts, and we're not able to break it down. When we are able to break those things down and figure out, wow, now I know why I'm feeling that way. Now I know what I'm feeling. And now I know where I'm feeling it in my body. I know what's happening to me. Then we're able to work specifically on those different aspects and break them down even more and figure out how to work with each one. But the first step is figuring out how to break them down, and they automatically become less overwhelming when we're able to figure out, this is the reason, this is why it's happening.
Years ago, I learned in Madreshet Emuna, I learned to be like a parenting coach. I didn't finish my degree. Some things went on in my life and I dropped out, but I learned a lot there. And I remember the teacher was explaining to us that same sort of thing where, I always remember one of the moms was saying how her daughter would throw pretzels on the floor and it would drive her crazy, right? And when we talked about what does that mean when she's throwing her pretzels on the floor, what is that meaning to the mom as a mother, all the different feelings behind that, until she was able to just be saying, oh, there are pretzels on the floor. Sweep up the pretzels, put them in the garbage. All the emotion was taken out of it. And the whole problem just went away because the kid stopped throwing the pretzels on the floor also because it wasn't getting the emotion out of her mother that she was looking for. So it's bringing me back to that sort of like move back, because when you don't, sometimes like looking at your life like a reporter, right? Like,
absolutely.
Oh, there goes Sivi. Look, Sivi's panicking when the baby's, let's say, crying or the baby's sleeping. Why is that? Oh, what an interesting, just not even doing anything about it right away, just realizing that you can look at it, that you and the problem and your emotions are not one. Because as you said, when you feel that in your body, it feels so real, right? You're like demystifying like something that feels magical almost. It feels like it has to be, and you're just poof, taking the wind out of the sails, and then it just becomes a sleeping baby or a crying baby.
Absolutely.
And then you can start going through the steps, and I guess getting to your core beliefs, to your emotions, to your feelings. Wow. So this is definitely for raising teenagers. This is going to help your moms. For sure.
I mean, it's any age, and a lot of the time we'll have, people will have one specific child that they feel more emotionally enmeshed with, or they have a harder time, dealing with a specific cry or setting a specific boundary, and that's part of the work that we have as parents, is to separate and know, this is my child, this is what my child is trying to do, and this is what my child wants, and this is where I am, and not to get, confused together. And because basically when we are confused together and we feel the child's anxiety so greatly that we're not able to calm the child down and calm ourselves down, then that's one of the biggest issues, that we need to be able to separate ourselves from them.
So you're bringing this to another level where your child's anxious about something and you feel so connected with them that you become anxious or upset about that. That's a whole
That's a
another
whole
level.
nother level. And
I just had that the other day. My daughter she wasn't even upset about it. She told me something from school, my little one, and she wasn't really upset about it, but the thing she told me was about a girl who was mean to her, and she was like, "Oh, it's okay, mommy," she was just, it was in passing, but it really bothered me what had happened. And especially because this is the same one with the epilepsy and everything, and she has so many things on her plate, and my heart was like on the floor. I was in the morning, and I was trying to get the kids off to school, and I was trying to have, a cheerful, happy morning, and I felt like my heart was like I was having to scrape my heart off the floor. And I just stopped for a few minutes, and I said, Hashem, this is her path. This is her things. She can handle it. It's not me. I was literally taking my hands and like pulling myself back into myself. And if I don't get the kids off to school cheerfully, then that's not going to help her have a good day. If I don't get them, I was so upset by what she told me that I just wanted to crawl back into bed. I just wanted to cry. I couldn't even function almost. And I had to take those few minutes to get back into myself, because of her situation. I do feel very, very connected. She's also my baby, my youngest. So I do feel that connection. And I waited. Once they were off to school, I talked to my friend about it a little bit, went through a little, personal therapy session with my friend just to process that whole thing. And I was grateful that I was able to separate myself, but it's been, years and years of training. She's the youngest of my oldest daughter is 28 years old. So I've had a little bit of experience and a lot of things I've learned along the way. I've learned cognitive behavioral therapy. I've learned, parenting. I've learned so much. I've trained myself. But even for me, it was really, really hard. So for sure, when we're new at this and we're young, it's so hard sometimes to pull back, get back into yourself, figure out where your part is. It's an amazing opportunity to sit with you and to be able to learn these skills as a young mom. I mean, that's just wow.
Mm-hmm. Great, thanks for sharing. I mean,
yeah.
It keeps coming back in different different nuances.
Yeah, I think, like I said, this is, I think, learning that we have our whole life. My friend that I called, she's turning 60, and we always laugh. Like, we don't finish learning these things. I mean, till B'ezrat Hashem, we'll be learning till the day we die. It's a lot of learning in life, but it's really good. And it's an amazing opportunity to bring this to young moms. I wish I had that. If I could go back and give myself some of this wisdom when I was a young mom, I'm sure this would have helped me so much.
Mm-hmm. Absolutely. Wow. So now you can pass it over to other young moms that can benefit from it.
And that is why we're here today. Exactly.
That is why you're there today.
That's amazing. So if somebody is in the Renana area and they'd like to join one of your groups in Hebrew, or maybe get a group together, how many women would you need to start a group in English?
I wouldn't take more than 6, and then people can come with the babies as well.
Oh wow! So it's a nice small group.
It's a small group,
and you don't have to find a babysitter. So that's the best. Yes. And they can play. Oh, I love that! Like a mommy and me therapy.
Yeah.
Self-development thing. That's amazing. Wow. So we're going to put this in the show notes, but how do they get in touch with you?
So either I can leave my email or my phone number, and I have a Facebook page. I don't know how I can link it somehow.
Yeah, you're going to tell us everything out loud now, but then you're going to give me all that information, and it's going to be in the show notes, both on YouTube, on the podcast, everywhere that this is playing. Okay. But also for people who are more auditory, if you can just tell us out loud.
Okay, so Leah Tipul, Leah, Tipul is TIPUL @gmail.com. You're welcome to contact me there. My number is 052-577-4748. And yeah, I have Leah Therapy is my English therapy page. You're welcome to. Oh, and I'm sorry, I'm going to have to go. The teacher's giving me a call.
Oh, about your daughter. Okay, great. So you can go because I'm up to the point where I'm going to tell them how they can get a discount if they contact you.
Okay, great.
I'm going to give away some free stuff, but you can go take care of your daughter. I hope she feels better.
Okay, great. Thank you so much.
Thank
Bye.
you. So if you contact Leah and you would like to have a session with her, I'm just going to make sure that I'm giving the correct information. All right, if you mention Geula Mamas, you get a 50 shekel discount for your first meeting with Leah. That can be on Skype or on Zoom. And we have here today our magnets. Let's see, I've got 2 magnets to give away to you yummy, delicious ladies. The way you can be entered to win your Geula Mama magnet is by just joining our Facebook group. Everyone who joins our Facebook group can get a Geula Mama magnet coming by snail mail to your door, to your house, and it goes right there on your refrigerator. I actually like to keep them on my front door. In Israel, our front doors are all made of metal, so they're great for keeping magnets on. So we have 2 today. First one says, whatever you do, just Kegel. That is from Tamara May, the physiotherapist. She was absolutely amazing. She taught us how to Kegel correctly. That was, I'm thinking, show 3. I'm not sure. You can look up Tamara May. So that is her reminder to us. And we have a Geula Mama's affirmation. It says, I am so precious. Hashem loves me more than I can ever imagine. Just take that in. Whether or not you win this magnet, please remember that it's true, and I will work on remembering that it's true, that Hashem makes each of us, and He loves us. He loves us so much. So if I'm picking your name today, we will be in touch, and we'll get your address. We have a magnet for Bracha Nir and for Karen Yahav. Well done, Bracha, and well done, Karen. Yay! All right, so if you enjoyed what you heard today and you think of anybody this could benefit, would you please take a moment and share this with her? Actually, we weren't even directly talking about anything specifically pregnancy related, so you can share this with her or him. This could go to anybody who really would like some help with anything anxiety related. I'm actually thinking of a relative of mine who's male, and I'm going to share this with him because I think he could really use some of Leah's wisdom here. So if you can share this, and together we can do our part to bring the Geula. Please go forth, have a great day, and remember that Hashem loves you and I love you. Goodbye.